Do you sometimes feel short of breath, like you can't catch your breath even after resting? Or maybe you've noticed your urine looks a bit dark or foamy. These might just seem like small issues, but they could be signs that something deeper is going on, like Goodpasture Syndrome. This rare disease attacks your lungs and kidneys without warning. At first, it might feel like a cold or fatigue, but over time, it can cause serious damage. Imagine your body's immune system suddenly turning against you, like friendly fire in a battle. That's what happens in Goodpasture Syndrome. The body mistakenly attacks the tiny filters in your kidneys and the air sacs in your lungs. It's rare but dangerous, especially if not caught early. So, if you or someone you know has sudden breathing problems and weird urine changes, it's worth paying attention. What causes your body to attack itself? That's the big question in Goodpasture Syndrome. Normally, your immune system fights germs like viruses and bacteria. But in this disease, it gets confused and attacks the basement membrane, a kind of strong filter in your kidneys and lungs. Think of this membrane like a super fine sieve that keeps your blood clean and lets your lungs exchange oxygen properly. When the immune system makes special proteins called antibodies that target this sieve, the filters get damaged. Why does this happen? We're not 100% sure, but certain triggers can turn it on, like smoking, breathing in fumes, such as paint thinner or cleaning sprays, or even a bad flu. Some people might have genes that make them more likely to get it. For example, if your dad had an autoimmune problem, maybe your body is more likely to make this mistake. It's like a perfect storm. Genes plus environment equals confused immune system. Let us play a quick what's wrong game. Imagine two people, Alex and Jamie. Alex keeps coughing and feels tired all the time, but thinks it is just allergies. Then one day, they notice blood in their spit. Uh-oh. Meanwhile, Jamie has swollen ankles and pees foam every morning. They blame it on salt in food. But both could have Goodpasture Syndrome. Why? Because the main signs are lung and kidney trouble. In the lungs, coughing up blood, shortness of breath, chest pain, like having a never-ending cold with scary extras. In the kidneys, dark or foamy pee, that is protein or blood, swelling in legs, high blood pressure, and feeling very tired. Sometimes, early symptoms are vague nausea, not hungry, feeling weak. That is why it is tricky. It sneaks in. So ask yourself, has your energy dropped suddenly? Does your pee look odd? Are you out of breath climbing stairs? If yes, it might be time to talk to a doctor. How do doctors catch this tricky disease? First, they ask how long have you felt tired, any coughing of blood. Then come tests, no way around it. Blood and urine tests check your kidney function. Foamy urine, they'll test for protein and blood. A blood test can look for the harmful antibodies attacking your body. But the real proof often comes from a kidney biopsy, where a tiny piece of kidney is taken with a needle and checked under a microscope. Imagine confirming a fire by checking the ashes. It's that definitive. Once diagnosed, treatment starts fast. The goal, stop the immune system's attack. They use medicines like steroids to calm the immune system and drugs that kill fast-moving immune cells. Another key treatment is plasmapheresis, fancy word, simple idea. Your blood is cleaned through a machine like a filter to remove the bad antibodies. Think of it like changing the oil in a car to remove sludge. With early treatment, many people recover. Without it, kidney failure or lung failure can happen, so timing is everything. Can we stop Goodpasture Syndrome before it starts? Not completely, but we can reduce the risk. Let's say you have a family history of autoimmune diseases. That's like having a watch out sign on your health record. The top thing you can do, don't smoke. Seriously, smoking and inhaling chemicals can trigger the disease in some people. Imagine your lungs as clean filters. Smoke damages them and may signal your immune system to go haywire. Also, be careful with solvents or strong fumes at work or home. Use masks and ventilation. If you work in painting, mechanics, or cleaning industries, take safety seriously. Regular checkups with urine and blood tests can catch kidney issues early. And if you ever have sudden coughing with blood or odd fatigue, don't brush it off. Tell your doctor everything. Prevention isn't a magic shield, but healthy habits and awareness are powerful tools. Science is moving fast. While Goodpasture Syndrome is rare, researchers are diving deep into how to treat it better. One exciting area, targeting only the dangerous antibodies without shutting down the whole immune system. Imagine a smart missile instead of a bomb. New drugs are being tested to block the exact immune pathway that causes the damage. Also, there's hope in gene research, figuring out who's most at risk based on DNA. Some studies are even looking at regenerating damaged kidney tissue using stem cells, though that's still early. Another cool advance, faster antibody tests that give results in hours, not days. Why does this matter? Because time equals kidneys. The faster we diagnose and act, the better the outcome. Researchers are also building registries, global databases, to learn from every case. So even though you may never meet someone with this disease, science